Thank you, Madam Secretary. I come, as you know, from a state that officials, like some members of Congress, compete to come up with most critical comments about the Affordable Care Act. And yet, only yesterday in our state capital in Austin, a state official testified that when this law is implemented, the percentage of Texans who have insurance will go up from 74% to 91%. And I hope he underestimated it, and we can get it higher than that. We've heard about just now about all these wonderful proposals that are out there, but Republicans have had more than a year now to advance the replace part of repeal and replace, and to date, all we have is one page of 12 platitudes that they adopted with enthusiasm last January. A concern that I have is what happens in naysayer states like Texas, which have so many uninsured individuals that could, and I hope will, benefit from the Affordable Care Act. Now, Texas, of course, when it came to those who were high risk, it took the no, we won't help approach, and you reached out, and a number of states, for different reasons, did not provide the high-risk pool and provided a network or a national network of high-risk pool for those states like Texas that said no. If Texas, which has sent back, I think, about $900,000 of the $1 million grant they got to begin preparing, if Texas is not ready in January, will you be ready to assure people in Texas that they can get access to the exchanges through the Affordable Care Act?
Well, Congressman, as you know, the way the Act is written, states have the authority and the ability to not only set up a state-based exchange, but with resources and technical assistance provided by the federal government, if indeed a state opts not to take advantage of setting up a program at the state level, we are directed to set up a federal exchange. So the discussion earlier about additional resources at the Department of Health and Human Services are to do just that, to put the framework together for a federal exchange to make sure that Americans, regardless of where they live, will have access to the benefits that an exchange can provide come January 2014.
If Texas sets up a program, and like our Medicaid program, it's far inferior to that in other states, how much flexibility does the state have, or put another way, how likely is it that our citizens end up with a state program that provides much less in the way of coverage and benefits than those in other states under the announcement you made recently about these state exchanges?
And if you could answer quickly, because time's expired.
Well, I think the essential health benefit definition that you're talking about tries to balance a comprehensive insurance policy with affordability and with the notion that insurance is regulated at the state basis. So I think there are some underlying rules, what categories need to be covered, anti-discrimination, making sure that there's competition and no cherry picking. And then we hopefully will have some state flexibility reflecting the fact that those programs, those benchmark plans have been marketed and priced at the state and can be up and running.